think what's very exciting about the time we're in is we work in many countries, the Philippines being one of them, where there is this opportunity for a massive leap forward, where we don't have the issue of historical systems or legacy systems that tend to encumber us. And this gives us a great opportunity to come up with digital solutions that can essentially transform healthcare very quickly into best-of-breed solutions. And I think that is truly the exciting thing about being here at this point in time. And I think Takeda shows great initiative in kind of contributing to that effort. So looking forward to what comes out today.
Okay. It's great to see start of how MNCs are actually eager to work with startups now. This has happened. It's been happening in places like Europe and the States, where a lot of the big corporations are very willing to work with tech startups to augment their innovation initiatives. It's one of the first times I've seen it here in Southeast Asia, in the Philippines. Because a lot of the MNCs here are more marketing centered or marketing focused, and it's very exciting to see the start of innovation-led relationships between big companies and startups.
I'm happy to be here because I'm from the academe. I teach in the MS Health Informatics program of the University of the Philippines. At the same time, I'm also a doctor, so I see patients at clinic. So when the two come together, healthcare, innovation, technology, that's something I'm very excited about.
So for Takeda, this initiative is really something new for us. Like Jay said, it's also new for MNCs in general. So for Takeda, we want to do this innovation, we want to do this challenge so that we can reach more Filipino patients, and that's what we're aiming to do. And like I said before, I really would encourage other corporates to engage in the innovation community so we can bring more of these innovations.
Just like Dr. Tan, I'm also happy to be here, and as a breast cancer survivor myself and a doctor, I would like to give my hats off to Takeda for reaching out to patients through innovation, because I really believe that through innovation, we really break out of the box, and the thrust of healthcare is really to be patient-centric. So I hope, or we hope, that after this afternoon, we still start or begin working together towards improved healthcare for our patients.
Thank you. I'm very honored to be part of this initiative. I'm glad that Jerome from Takeda found us online and asked us to participate in this wonderful initiative. It is a conglomeration, a convergence of all the things that I've been doing for the last few years. So it's a combination of my corporate experience when I work in the US and in other countries, in the corporate world, which has helped me deal with Takeda, a beautiful bureaucracy, like most MNCs that I was part of before as well. The last 4 years I've been organizing events and activities to promote the tech industry and to encourage more people to delve and experiment in startups in the Philippines. It's a wonderful opportunity for us to showcase our creativity in the tech entrepreneurship area. It's not easy. Starting a business is not for everybody, but we have to give it a chance to succeed. And thank you for giving me this opportunity to help make this program be successful.
Thank you. I think our panel is more than ready to answer our questions now. Please.
What's the outlook? What's the outlook? I wanted to ask the panel, what's the outlook of digital health in the Philippines and in other areas where Takeda is operating?
So we all know digital is around us, innovation is around us. There is actually so much innovation coming through from the startup community that it would be a shame if we cannot embrace that, if we cannot engage that. And so this is what at Takeda we're trying to do now. Of course, with Takeda, we're healthcare focused. Healthcare is often a challenge for us in the Philippines, largely around getting access to treatment or access to a hospital. So this is really where we're hoping there's more and more through this challenge that more and more startups will start to surface and approach us and see how we can work together so that we can bring these innovations to the community. And so it makes for our doctors, makes their life easier and so they can help their patients as well. Maybe you want to.
Well, personally, I'm also engaged in a startup telehealth industry myself. And I would say that Filipino patients are starting to open up their minds in being able to embrace digital health, unlike before but of course, it's just to augment primary health care. So, I'd like to answer your question, I'd like to believe that Filipino patients are starting to go beyond social media in terms of just all about, showbiz and others. And they're trying to deviate already two essentials in life and healthcare.
Any more? Dan?
Hello, good morning. Thank you for the invitation. I would like to ask Dr. Giasison and anybody else, what would you be looking for in a digital startup, a starting company that would be able to help Filipinos and maybe all over the world? What would you be looking for? What characteristic of the startup? What would be most effective in your mind? Thank you so much.
Well, I'll be detaching from my role as a doctor, and I'd like to speak as a patient. I would want to look for a startup that would address my needs. Like when I was battling with cancer 3 years ago during my chemotherapy period, I was looking for little things like support. So the little things that matters to patients, like reminders for diagnostic tests, scans, even psychosocial support, linking me up to support groups, that would matter to me. So I would look for something like that in a startup company. And of course, follow through. It doesn't start with having the illness at the moment. I would like to see a startup that would sustain my state of health, that would constantly remind me that, hey, it's about time, it's that time of the year that you need a scan, etc., etc. So it's the care, it's the pre, the during, and the post care.
To add, I think if it were me looking for a startup, the startup would have to solve real problems. And I'm not an oncologist or a cancer patient, but my field is in diabetes and endocrinology. And in any disease that requires chronic care, the problem is actually healthcare navigation, which is what Gia mentioned. Like upon diagnosis, what do you need to do? If you need to go into chemotherapy, what are the resources available? If you have to go for a funding agency or to ask for PhilHealth, for example. So there are a myriad number of steps. Once you're in the chemotherapy, what information do you need about the side effects, etc. So we call that actually the patient journey, and that's something that we need to map out, and that the startup company will now determine which parts of the patient journey they are going to address.
A lot of the solutions that I've seen so far are based on reactive responses to health issues. However, I've seen some that are focused on proactive health, prevention of diseases, prevention of conditions, and for me, that's the future that you can look forward to with regards to digital health, and that can be composed of access to information, reminders to take medication, etc. So proactive health is one of the things that I'd like to see.
think specifically to oncology, we see three major issues. One is in the availability of medicines, making sure that patients can have medicines available wherever they are, regardless of where they live. Number two, it's affordability of medicines. Price of medicine remains incredibly high. So finding ways to help patients navigate the system in order to get more affordable care is important. And the third is really adherence, right? And this dovetails more to the patient journey. How do you support a patient from initiation of treatment all the way through support and positive outcomes? So I think, what we see is, what would be interesting is to look at startups that are solving the availability, affordability, and adherence issues within oncology.
Would you, Ms. Tinamper, I'm not really familiar with the startups, so would you please enlighten me, everybody else, what goes on after a startup shall have been chosen? Incubation, everything, what goes on? Thank you.
Okay, so for this particular program,
Yeah.
yes, okay. I will speak in general and then I'll give the mic to Gabriel. It depends on the startup that wins and what kind of support they need or is most appropriate so that we can deploy their solutions in the Philippines, right? So there's 10 different startups. They're in 10 different stages of production. We call it production ready when the product is already being used and being used by doctors, by patients today. So the startups that are in the top 10 are the term they use is post-revenue. Many of them are already being used out there by doctors, by patients, by others. So if for example, just an example, if one company has already been selling for their product for 1 year to 2 years, then partnering with Takeda, in my opinion, and if all parties agree that this is what they're going to do, then one way Takeda can be helpful for the startup is to give that startup access to more healthcare professionals or access to more patients. The winner will win $10,000 and it's up to them how to spend it. So when the winner is declared, there's going to be further meetings with Takeda because it will be determined what's going to happen next specifically for that startup. Right, Gaben?
Thank you.
Sure, you summed that up nicely. So from, if I can add, so we would also like to help by, providing maybe medical information, giving them access to more medical professionals that they can talk to. So if the focus is Hodgkin's lymphoma or in general terms oncology, then we can connect them with hematologists, with medical oncologists, with the rest of the medical community, where they can actually engage in conversation and get more ideas as well. And we would obviously be more than happy to do that.
Okay. We also have questions from the blogging community.
Good afternoon. I just wonder about the hospitals and medical centers in the Philippines. Are they willing to share their data, the patient's data, with each
other? What I do know is that the government is trying to put up the Philippine Health Information Exchange, okay, where hospitals or points of care are supposed to contribute their data into a shared health record so that a patient can actually access these records wherever he is. But it's in the very preliminary stages. So I was at the summit last week that had to do with health records from the government side, and they were talking about how to actually get that rolling. And they're working on standards and interoperability to make sure that it will all work out. But really, at the very beginning, it should be the patient, because we have the Data Privacy Act, and you cannot do anything, process the data or whatever, without the patient's consent. So that is at the center of it. Before you even ask the hospitals whether they're going to share the data, you have to ask the patient whether he's willing to have them his data.
But you see, the problem is if you go to one hospital to another, they will ask for the urine analysis, they will ask for the x-rays, all in all. No shame.
The other concept that that is there is really personal health records, where the patient keeps the records for himself, so that wherever he goes, he can have access to it, and he can grant access to whichever healthcare provider he wants to give access to. So for me, it's really a pull of whether the government is going to get ahead and get the sharing done, or the patients themselves do it because they are becoming more empowered and carrying the data themselves. So it's not unusual, for example, that I ask for an MRI and I get it in a CD. Okay, or if I wanted to have it emailed, some sort of result, that there are labs that actually do that now. They email it. So sometimes people come to my clinic, they don't even have the paper anymore. They show me their smartphone, and the result is there. So what would have been easier is if the result on the smartphone would actually go inside my EMR immediately, right? That's another thing. But then, as you said, there's still some things to be fixed for interoperability.
How about those patients who are not capable with having the access, or those having without access of internet? What other options or assistance can you offer to them?
Okay. Well, that is really what we call the digital divide. And since, was it last year, the DOST launched a service where they wanted to put free internet in major parks and other public places for people to actually get access to the internet. But they have a program wherein they want to provide internet access in municipalities that are far away. I don't know what the progress has been, but the project is there. G and I are actually on social media, and so in a way what I have seen is, even if people don't have access to internet, news organizations go to social media for the news, and so it also comes out in radio or in the newspaper, so that people who don't have access to internet sort of also get a feel of what's going on. But that is really the challenge, to go and reach the Filipinos in the underserved areas. Remember, they were saying how many Filipinos die without ever seeing a doctor. So it's really trying to reach them, and we have an archipelago, so that actually compounds the problem as well.
So there are health tech applications that are not only available through the internet. There are some startups that have solutions through SMS, specifically for our market and some in Africa. Right? I know of a startup in Cebu that works with NGOs and organizations that reach out to their target market via a combination of things. An actual phone call, like a robot call, like an automatic call, just to check on the person, an SMS. The application that they have is, for example, their client is an NGO that's giving microfunds to people in Leyte, right? How does the NGO ensure that the recipient is worthy enough or is using the money enough? So what they do is, first, before they're given funding, they're being educated through text. So the potential recipient will receive a text to say, you applied for this program, we just want to ask you some specific questions, or how would you spend your money, or did you receive your allocation, blah blah blah. So text lang, and then the recipient replies back. So it's a way to connect to the beneficiary without use of an internet, and also just to make sure that a constant yung connection, right? So there's no internet. That same product. So the SMS is just a delivery platform. So at the end of the day, they're still fulfilling a service. Like there's still an NGO that provides microfunds, but how they are performing or communicating with their target audience is SMS, actual phone call. Kung may app, may internet, then app, internet. Kung may website, kung may internet, then website.
Yes, good afternoon. Can we know some specific time frame for the winners? Example, when do they get the 10K prize? And
Classified information.
is it lump sum ba or tingi-tingi? Or, and then, what does Takeda or NTech expect from the winner? Kasi it was mentioned earlier that some of them are already operational or running. So, what do we expect from the winners?
Sure.
From the winner.
So in a few hours we'll receive the 10 pictures, okay, and then we will announce a winner today, and they will be presented with a check today.
The same day.
They will receive the funds, and so the way we've done it is Takeda will provide support, okay, but we will not dictate in any way how they use that money. So we're staying impartial from that perspective, but we are there to provide the support, same with Tech Talks, and to connect this startup with different parts of the community, especially the medical community. And that's where we can help them.
And since some of them are already operational, they don't need to go through the incubators.
No, well, if some of them are already sort of established, then no. Even if they feel they don't need to, but they will need help in other areas, then that's exactly where we can help. For sure.
Okay, thank you.
Yeah, the incubator is an option.
Okay. Review. Oh, okay. So, is that a follow-up question or?
What's the outlook on IoT and digital health?
IoT.
Internet of
Internet of
Things. Internet
Things.
of Things.
Are you familiar enough?
Well, I think it's very early days even for IoT per se. And everybody's scrambling to look for different types of applications to put on the IoT framework. I've encountered people from Intel, for example, that are putting together an IoT gateway, which you put at home. And the idea is for medical or health devices to be able to connect to that gateway, send it to the cloud. Because the thing about IoT vis-a-vis your regular Wi-Fi connection is that the size of the data being sent to the cloud is very, very small. So it uses a different protocol or a different method. It doesn't need a high bandwidth. It only requires bursts of information, most often than not one way only. So that's the space that thing is addressing. I wouldn't be surprised to see maybe I haven't seen any devices yet this year, but maybe next year when these health bands and diagnostic equipment start adopting that type of data transmission, take advantage of the IoT idea.
Thank you. Any more questions? Rainier? No?